Do you wake up with tight hips, especially in this area? Well, it might be your hip flexors.
Oh, it's my turn.
It's your turn.
Just hanging out here. Well, I'm telling you, that muscle down there, that area may affect not only your posture, but your walking as well as back pain.
The good news is we have a 90-second solution to help decrease any pain or tightness in that area before you even get out of bed.
Right. Now, don't give us that stuff about if it's 90 seconds, how come it took a few minutes? We got to explain how to do it and educate you. We're going to go back in time. Bob and I did a supreme video on how to do it. It's well watched, well received, and you'll learn everything you need to know.
It's better than
We're an educational channel, by the way, and don't let anybody tell you we're not.
Supreme. Anyway, make sure to stick around because when we come back to the present time, we got a additional stretch to try.
There you go. Have a good time watching it. It'll be.
Are you going to time warp? You like your.
Whoa, here we go. That's right. We got to go back in time through the vortex.
Oh, I wasn't there.
But he's not going.
Maybe I was running camera.
Yeah, don't jump too much. Ready? 1, 2, 3. Whoa!
Bob and Brad, the two most famous physical therapists on the internet.
Today we're going to show you how to unlock hip flexor tightness and pain in 90 seconds in bed. And you know what? I am really excited to see this because I don't know what Brad's going to do. This is new to me, and I do have trouble with my hip flexors, and I've been foam rolling them. I've been massaging them. So I'm really anxious to try this, Brad.
Yeah, this is a different approach, much easier, and it's been going on for decades, literally, this whole technique.
All right, I will watch it today, then I will do it, and I'll come back and report.
Say no more,
By
Bob.
the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, if you get a chance, go to bobandbrad.com, go to the giveaway section. We're always giving something away. Right now, we're giving away a Thermotex far infrared heating system. This is awesome. This is far infrared heat, which means instead of penetrating just a few millimeters, which is what normal heat does, it's upside down.
Normal heat.
It actually goes this far.
Yeah.
Radiant heat, right?
I think it's convection.
Convection
Your
heat.
typical hot pack you buy for
Right.
$20 at the
So this
pharmacy.
penetrates much deeper, makes a big difference. Brad and I are big fans. This is actually mine. I have it attached to the cushion. I put it in my chair, and it gives me a little support, and it gives me...
Well, it's nice of you to bring that down,
Bob. Go to Bob and Brad on Facebook. You can find the contest pinned at the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
Wow. That was good, Bob. Okay, let's talk about the hip flexor. So the hip flexor flexes the hip. And it's actually, I always tell my patients, if you look where your pocket is, where you put your hand in, that's where the muscle is. We're going to show you actually a little more detail with Sam I am, where where this muscle is. Now we call it a deep muscle because it literally is deep. It's, if you look at your stomach right here, to get to it, you actually have to palpate and push through your abdominal muscles and then some visceral, some of your internal organs kind of can get in the way a little bit. Your appendix is close to that. So it's really a hard muscle to massage. So if you got a tight muscle and you want to massage it, some therapists do it. I personally have never done it.
I don't either.
It's really difficult, but some people are good at it. As far as the layperson doing it, I do not recommend it, even trying. It's just too deep. But this technique, you don't need to. That's the beautiful thing of it. So here we have the pink is the, help me out, Bob. I got
Iliopsoas?
Yeah, but there's the ilium, that's this one.
Yeah,
and then the
iliacus.
psoas is the red muscle.
Sure.
And the red muscle, the psoas, actually connects to the lumbar spine. And that's why back pain can be associated with a tight
Yeah, it's going to some of the lateral attachments of the back, so it can pull on the back.
Exactly. And then this is on the pelvis, on the ilium or the pelvis to the layperson. It connects up to the femur, the inside of the femur, and the location and the anatomy and the biomechanics of this is really critical to make this technique work.
Well, if you see, by the location, origin, insertion here, that you can see, it can pull up the hip here.
Yeah, exactly.
And make it flex.
Yeah, exactly. All right, Sam, you're done.
Thank you.
All right, so let's get on to the technique itself. So you can do this on a carpeted floor. You could do it in bed. It really doesn't matter.
Pillows, Brad?
Yeah, probably just one, I think. There you
Okay.
go. Thank you. All right, boy, it matches. Okay, so what you're going to want to do is, say my right hip is the painful, the tight hip. I'm going to sit or lay down in what I call a hook line position with your knees up.
He's going to lie down.
Lie down. Now, I want you to take note of how your hip felt prior to the technique. And then afterwards, we're going to compare it again. So let's say it was tight, it's a little painful, and it says like about a 5/10. 10 being the worst pain you've ever experienced, 0, no pain. So right in between there. And it's feeling tight. What you're going to do is, first of all, you need to relax. And now what they say to do as far as if you're a therapist, we're going to palpate in and find that sore spot, the knot in that muscle. Again, we're going to skip that. You're going to slowly bring up your hip, knee going to your chest. And then as you do this, you're going to find the position of most comfort. So typically, it's going to be as close as you can get the knee to the chest. It may be in towards the shoulder across your chest. It may be over to the side. Everyone's going to be a little bit different on this.
So, Brad, when you say this, now, if it feels better out here, that's not what you're talking about. You're talking about the position of most comfort once it's pulled toward you.
Right.
Okay,
The whole goal of this positional comfort is to shorten the muscle, because we're going to
Sure.
actually release the tension, allowing
Gotcha.
blood flow into the muscle, which allows pain relief and healing.
So, yeah, right now the muscle is definitely
Shortening
shortening up, yeah.
exactly. But sometimes there may be it feels a little bit better. And again, you do what feels best. Now, one thing that most people will find is a little more comfortable is if you rotate the femur. In other words, my foot, you'll see, is going to go towards that way.
Interesting.
Yeah. So, because the
Right.
flexors
Is it
are
external rotator?
right, exactly. So we're going to shorten it up. Now that may or may not work for you. If it does, definitely try it if it feels better that way. And for me, I do this a little bit, but not too far over here, right about in here.
I said that wrong, Brad, didn't I? It's an internal rotator, right?
No, it's an external
Oh.
rotator.
I have to think too on that.
That's therapist talk. You
Sure.
don't need to
You
know
can
that.
ignore that.
Right.
Just listen to him, turn it in.
Yeah. And then you got your pillow. You're going to take a breath, and you're not going to start the 90-second treatment until you find that most comfortable position and you can relax. I'm just going to hang out here.
So basically, you're shortening up the muscle
Right.
to the shortest position.
Yep.
It's comfortable, and that's the way it's going to relax them, because the stress is all taken off.
Right. And that's the whole theory between the strain, counter strain treatment,
Gotcha.
or positional release, which has been studied thoroughly over the years. You really need to look at get your cell phone out or look at a clock with you need to go 90 seconds.
90 seconds.
Minimum. Yep.
So you
Yeah.
can go longer,
You can go longer,
but
absolutely.
don't go less.
Right.
Gotcha.
And then when you're done with that 90 seconds, this is important. Don't just let it drop down. Take your time and let it go down slow. You're going to keep relaxing and breathe. Everything goes slow with this. If you want to do some gentle range of motion, you're going to do that. You're going to get off the couch or the bed, whatever you're on, and just take your time and everything. And you stand up. You're not going to do any aggressive hip flexor stretches. We have videos on those too.
So
We're not going to do that.
You wouldn't do that at this time.
Right.
You do it at a different time, possibly. Then.
Right.
Yeah.
Right,
Okay.
Right.
So this is done separately from that, and those aren't in conjunction.
And I'm
So
saying if you have good results with this and it's feeling loose, you may not have to do
the
this,
other
the
one.
hip stretches. It's possible you're stretching too hard and irritating
Oh,
it.
irritating, and it's responding.
Exactly.
It's spasming almost, and
Right.
So, how much? Do you mind if I try it once, Brad?
Oh, Bob. Yeah,
So-
absolutely.
So I'm going to use a different pillow.
Yeah. We don't want to get those mixed up.
Yeah.
Yours is the same color. Wow.
So I'm going to bring it up, this all the way down,
I would,
or up like
whatever's most comfortable.
Okay.
You're in a position of
this.
maximum
bring
comfort.
It up, so I can feel that now. I can feel pain already now.
Okay.
So now
Now-
I would bring it over, maybe.
Well,
Well, that's worse.
Okay.
And that's a little better.
Okay.
Now let me turn it.
Yeah, rotate a little
Oh, that
bit.
definitely feels better.
It does.
Yeah,
See,
that's
now you're
definitely
on,
better.
you don't have to be the therapist. If a therapist is helping you, they're going to get feedback from you anyways.
Sure.
You just don't go up there and put it in a certain spot. It's all feedback from the patient.
Yeah, this is definitely the better position.
This feels good?
Oh, yeah.
I hit the timer right now.
All right. Well, I've been doing it for 15
Bob,
seconds
Bob,
already.
you're talking. This is video. It doesn't count. We got to hit the timer. But anyways, yeah, because you can go longer than 90 seconds.
Sure.
So that's okay.
Well, I don't want to have people watch
No.
dead air here
Okay,
right now.
time's
so
done.
I'm going to get up.
We'll pretend 90.
So then I slowly take it down, right?
Yep.
And I can see that because it would almost fire up if I let it down.
You may have to grab here.
Yeah.
You know how that
I
is
agree.
for some
I
people.
agree with that.
Yep.
I agree with that. And then slowly, and then you maybe bring it down, like you said, in a little bit of rotation back and forth.
Yep, gently. Everything's gentle, relaxed. Your breathing is relaxed. Everything. It's just a wonderful way to treat.
This is really interesting to me because this is something that I have to do like on weekends. My
Yep.
wife and I go for a long walk.
Right.
And I do stretches before I do that.
Sure.
And I'm going to try this.
This
and I
could change.
will report
This
back.
could change our lives, Bob, and a lot of other people out there working too hard to. You feeling like a new man,
Yeah.
aren't you, Mr. Bojangles?
That's right.
Yeah.
He jumped so high.
Yeah. Oh my
He
God.
jumped so high.
I just listened. I asked Alexa to play that song the other day. Oh, whoa, boy! That time travel was pretty tough. That time I thought I hit
you're
a,
back.
I
I'm
hit
about
a
to
wall.
stretch without you.
I'm okay now. So what are you doing?
I'm getting ready to show how to stretch your hip flexors
Oh
out.
yes, this is another option that we wanted to show you outside of the memory lane. That 90-second technique. This is by Rick Olderman. This is if the 90-second technique one doesn't work, this one should.
So what you're going to do is lay on the edge of a firm surface. The reason we're doing it this way is because your back is nice and supported and you can't arch too much and you're going to get a good hip flexor stretch. So you may need to lay on a firm bed, countertop, table, whatever you can comfortably get on. I'm going to drop one leg down and then I'm going to bend my knee back and I'm going to bring my opposite knee up to my chest. You'll see my hip flexors pulling up a little bit here. Just let gravity try to stretch that out. You're going to hold it for roughly 30 seconds. Make sure to breathe and relax and then don't let your leg veer off too far to the side because I'm not really getting much of a stretch there. After you do one side, you're going to reset both knees to chest and then switch and do the opposite leg.
Can you go the other way, Mike? I just want to emphasize what makes this stretch so unique. It gets the hip flexor in this area, the iliopsoas, but the rectus femoris, which goes to the knee, only gets stretched as if you pull this foot under, then you get that. Other hip stretches do not get that. That's why this could be the key to your pain and getting things to relax. You got a dent in your leg right there, Mike.
Those are called muscles, Brad.
Wow. That's
Anyway,
incredulous.
hold it for 2 to 3 sets of 30 seconds and try to do it each day to see if it helps loosens up your hip flexors. If you're really tight, your leg may be way up here, which I have seen with some people. So just slowly let gravity pull it down. You may even need to put a pillow underneath your thigh to start, or just back up a little more on the table or bed you're laying on, just so it won't be so intense.
Yeah, make sure you do both sides, and you'll see if one side is tighter, you'll definitely feel it. And like you said, looking at it, you can see the knee is higher.
Now, if you want some hip strengthening exercises, you can click the video link on the screen.
That's right. 5 of the best hip strengthening exercises to stay pain-free with age. So even people that have gray hair, it works well.
Or no hair. But I don't have the age component quite yet.
All right.
Anyway.
Take care and have a good day. Stay hippie. Get it, hip pain?
Yeah, I got it. Good job.
Bob and Brad, the two most famous physical therapists on the internet.